Another concern that we have is healthcare, and if you have watched, read, searched online, listened to the radio, in the past 20 years, you know that healthcare is a problem in this province. But in the past year, some of these headlines are going to look really familiar to you. New Brunswick doctors speak out on severe overcrowding in hospitals, calling it inhumane. I felt like I was on Main Street. Dumont patient spends 4 days in the hallway. And the interesting part of this article is in the middle of the page, and it's a statement by Dr. Dupuis. I've seen patients die in the hallways, he said, which really, that's the epitome of not having dignity. Chalmers Hospital chief surgeon frustrated by bed crunch. People ready for nursing homes or other care facility are using 25 to 27% of Horizon's hospital beds. Well, that's no difference in vitalities, okay? That affects both the French and the English. It's not an Anglophone specific situation, it's a New Brunswick situation. So we have hospital overcrowding. We have canceled surgeries. We have several hospitals, and these reports are available online, that have reports of poor maintenance and lack of cleanliness. We have a lack of nursing home and long care facilities. We have a definite lack of assistance and resources for mental health in this province. How many in this room have heard of Stephen Robbins? I see a few hands. Stephen Robbins was a gentleman in Fredericton area who had reached the end of his rope. He was struggling, he was hurting, and he went to the hospital for help. And he told them, I need you. I am going to hurt myself. I need help. He spent 6 days in hallways, fracture rooms, and kitchenettes because they didn't have room for him. He even had to meet with a psychiatrist in the hallway of the hospital. And on day 6, he had had enough, and he checked himself out of the hospital, and his body was found in the river 2 weeks later. That's not an English problem. That's a New Brunswick problem. There are 50,000 people in the province of New Brunswick right now who do not have access to a doctor. We've seen the closure and reduced hours of rural emergency rooms and clinics. We've seen a reduction of ambulances to small communities. So knowing all of this, what would you say if it were possible to save between $40 and $60 million by merging our two healthcare authorities? Okay. How much improvement to our current state of healthcare could we gain with $40 to $60 million?
A lot.
Well, guess what? Right now we operate two health authorities. Both of them operate bilingually, by the way. If you walk in as a patient, whether you walk into a Horizon facility or you walk into a Vitality facility, you have the right to obtain service in your language. The only difference between the two is that one is managed in English and one is managed in French. So we're paying dual salaries for, especially, the CEOs that are running these authorities. We're paying dual sets of insurance. We're paying dual facilities in some locations. Some locations we have a need of 2 facilities. Some we don't, and we're paying for it. But during a recorded CBC political panel in May of 2015, and I'm not sure how many of you watched these, but they are absolutely amazing because you bring all 5 of New Brunswick's political parties together around a table and they talk about a topic. And you get to hear and see what they stand for. During this recorded political panel, Minister of Health Victor Boudreau was asked about the possibility of merging the two at a savings of between $40 and $60 million, and he said no. And the reason that he stated was because we respect linguistic rights in this province. Okay? I've read the Official Languages Act. I know that you have the right to service in either language. I haven't seen anything in the Official Languages Act that says we have to have duplicate administrations and duplicate facilities. Okay. And previous, in September of 2014, the former Minister of Finance, Blaine Higgs, was asked the same question: why can't we merge our two health care authorities? And he responded, we could, but it would be political suicide because we would lose the Francophone vote.